As healthcare moves away from traditional fee-for-service models, providers need a strategy to stay competitive. That's where Strategic Healthcare Partners comes in. We offer expert consulting and ongoing management oversight for providers looking to form an accountable care organization. From financial feasibility analysis to helping you choose the right ACO in a crowded market, SHP provides the clarity you need to make informed decisions and transition to value-based care. Learn more at shpllc.com.
Welcome back to Beyond the Stethoscope, Vital Conversations with SHP. I'm Aaron Higgins. On today's episode, Jason Crosby and I finish our interview with Craig Kilgore about the challenges facing private practices in a post-pandemic world, as he pulls out his crystal ball to peer into the future of what he expects for the private practice scene. If you recall, Craig is the CEO of Coastal Vascular and Vein Center in Charleston, South Carolina. Craig has served in IT, finance, and in administrative executive roles. Are you ready for this vital conversation? Let's get started.
Kind of piggyback previous points, because you've hit on this, the point of you've got payer consolidation, you've got consolidation in the private practice market in terms of going the employed route, in particular because of COVID these last few years, and then volume slowly trickling back to some levels that are, back to where they were. And then you got staffing still a concern. So you got these variables out there that still present this challenge to the group. As you mentioned, you've transitioned recently from an ENT to a vascular group, but still a specialty private practice setting that all each experience those same variables and challenges. What sort of staffing initiatives, way that you've engaged your staff members or the physicians to kind of keep the morale, the culture, in a positive moving fashion, whether it's a, benefits thing or a team function or even a strategic initiative that, guys, we need to keep this practice moving forward. And here's a kind of a strategic objective we're going to work collectively to attain.
Well, it's kind of my opinion is that, people like to be part of an organization that is moving forward. They don't like to be stuck in a stagnant organization. So I think, by demonstrating that the physicians are interested in growing, interested in innovation, innovation, whether it's ancillaries, growth. So, that's a big part of any practice success. Private practice success is making sure that you have the appropriate ancillaries and that you are supporting them legally, nothing illegal, but appropriately, and that's always the first thing. But then actually looking at diversifying a little bit. So do they own their property? Do they own their real estate? That's a business strategy, and so that was a very successful one in my Charleston ENT days. So, it got to the point where, they now own all their locations and even some, commercial, properties. So they went beyond, just the practice on, real estate, but into commercial. So that's a success story in itself. The vascular surgery group is looking to do similar things, maybe not so much in the commercial area, but in the practice, owned properties. And so they just recently completed, before I joined, a new office with an ambulatory surgery center in Somerville. It's called a development called Nexton. And so I see those kind of things as people like to be part of something that has purpose or something that's growing. And a lot of times, and I get it, the risk associated with growth to some physicians, depending on their career, their stage in their career. Are they within 10 years of retirement, or are they 40 and going to work for another 20 plus years? I mean, a lot of that impacts their interest in growth and expansion. But that's what I like to do. I don't like to have to sit behind a desk and count nickels. I like to, be active and growing. And it's been pretty successful, I think, over my career. But if you look at other successful independent groups, they've done the same thing.
Yeah, that's some great points. What I gathered there, hearing your response, was the practice itself is one thing, but you don't have to get timid with growth because of the practice. You still, and in your case, you've got an ASC potential to grow via that path. You've got real estate as a potential opportunity to help. So looking at the total financial overall picture is more than just simply visits in your practice.
Correct.
Are you seeing that a lot more? You're really active in the administrator type networks, as you mentioned, and your experience, what you're seeing in South Carolina in particular. Are you seeing that quite a bit?
It's kind of a mixed bag, It's kind of, and again, I think a lot of it has to do with, the career cycle, of where physician owners are. The big things are you have to have a core group that's going to support a growth plan. But I would say yes, and I think it's actually going to expand because of the CON laws that changed in South Carolina. And so we can now go and open an ambulatory surgery center without having to go through the regulatory CON process. Now, you still have the financial constraints. You better get those serious concerns, but you have to be able to, demonstrate that you can meet your debts. But I think that most groups are finding that they can. And so, I think that's you're going to see more of that in South Carolina just because of the elimination of the CON laws.
That sounds like a really positive change for South Carolina. And here in Georgia, we still have CON laws. There's a lot of discussion around how should those change or evolve or go away. So it'll be interesting to see with our neighbor to the north how successful that's been for you all, because I think our markets are fairly similar in a lot of our key cities. So it'll be fascinating to watch. And obviously that's I think a positive thing. So let's go negative Nelly here for a second. From your perspective, where you're sitting as CEO, what do you feel like your challenges are going to be for the next, 3, 5, 10 years?
Yeah. Well, we've already touched on staff, so that's obviously going to be the number, probably the highest or the greatest concern. The other issue, that we're seeing, again, I touched on a little bit, but the number of physicians actually coming out wanting to go into private practice. And so, we're already seeing trends that, fewer and fewer want to be part of a private practice. More and more want to be in a employed setting. So it's going to really, limit the number of physicians for the specialists more so. I think it's very much a factor, for specialists more so than in primary care. I just know in ENT, my recent experience, I think maybe, don't hold me to this number, but I think there's 350, fellows that come out annually, and a third of those, are looking to do a subspecialty fellowship. A third of those are looking to go to work for somebody and like a hospital system. And so you basically have 120 ENTs coming out that are potentially looking at private practice for the entire country. So it's a real challenge. I'm not sure of this vascular numbers yet, but I don't think they're that much different, maybe even fewer, because a lot of the vascular surgery training programs that are, the more technology advanced and innovative ones are probably fairly limited too. So, it's going to be, staff retention and training. And then it's going to be providers, physicians. We have plenty. I think we have enough, PAs coming out, nurse practitioners, and certainly, with their expansion of their scope of practice, I think that's going to meet the needs for a lot of the primary care practices and communities. But, this specialists are going to be really in high demand, and there's not enough supply coming out.
Yeah, and I think you're right. Coming from my own background in private practice and in the specialties I was in vascular and in cardiology. We couldn't replace our retiring providers fast enough.
Right.
We would get someone fresh out of medical school with $500,000 in school debt,
True.
and yeah, we couldn't replace them fast enough because the difficulty is they had so much debt they couldn't go hang a shingle on their own. So it's certainly a challenge everywhere. So in a happier ending sort of question, looking back and even looking forward here, where would you define success? Where would, as a CEO and even as a private practice, what does success look like for you?
It's always been, my goal in working with physicians to see their success, for them to, thrive in practice growth, for them to at least, maintain a good, income and benefits, but also for them to have a good quality of life practice, a good balance, So it's things like that make me happy, at the end of the day. It's not easy to obtain, but I think that gives me the greatest success. And I wish I could get more young folks interested in private practice, because I think it's been such a great career. It is demanding, and I'll say that. I mean, unfortunately, there's way too many night meetings and stuff like that because physicians are working during the day, so it's not attractive to a lot of people. But it is a very rewarding career, and I think it's been I've enjoyed it. I like what I do, and I want to keep doing some of it. I don't know that I want to do the day-to-day grind for 10 more years, but I certainly enjoy the development and the growth aspects. That's what I really enjoy.
Great feedback, Craig. Maybe to sort of, wrap this loop back to our original question and to Aaron's last one to you. So we're both located near universities that have health systems, universities that have health administration type programs. Speak to those that might be listening that, you came in through a different route, the IT and finance path. A lot of these folks are getting the MHSAs or maybe the MBAs. Speak to them, if you will, about, okay, you're starting out, you're in this new challenging environment. Here's a couple of little nuggets from someone that's been there, done that, as to how to have a smooth entry into the space.
Yeah, that's great. That's great because we at ENT, they actually do have an internship program within USC. So we take they'll take 2-3 of the students for a semester to come and work, and I'm not as close to that. Obviously, I'm not there now, but still very familiar with what they were doing. But the biggest thing is that you have to get your hands dirty, and you have to learn it. You can't. It's not like there isn't a textbook, for practice management. There is. I say that, but you got to get your hands dirty. You got to sit at the front desk. You got to, schedule a patient. You have to, do demographics. You have to watch the revenue cycle. You have to understand the regulatory side. And, and I know a lot of their training, rightfully so, is more geared to hospital administration than it is private practice. But I'm actually on a advisory committee, within USC, to help give some exposure, to the private practice world. So, and it's not for everybody, again, but those that are ambitious and, are, willing to put the effort, the time, and the commitment in, it can be extremely, beneficial, rewarding, to them personally and from a career standpoint.
Great recommendation. I wish I could have asked you that a couple of decades ago myself.
You still got time, Jason. Come on.
That's great feedback, Craig, and with your background, I think folks will definitely appreciate it. And so, well, we've asked a lot of questions. We've gotten some great input. And I do want to make folks aware that you may not be able to see this, but Craig, as he put it, strategically placed a UT hat right over his shoulder. And so for those like myself in Georgia country, SEC country, that's the first thing you see. But
yeah. it's all in good fun. I love SEC. I love football, so love SEC football, but kind of have a passion for Tennessee Vols. So
hey, there's nothing better in the fall. Nothing better than a good fall Saturday in the South for football. So yes, most certainly agree with that. Well, Craig, on behalf of Aaron and I, SHP, we really appreciate your time. This was great insight. We'll be sure to include all the information we can in our show notes, and we thank you again.
Sure. I hope something was beneficial to someone out there. So I appreciate the opportunity.
Yeah, thank you for coming, Craig.
Yep.
You've been listening to Beyond the Stethoscope, Vital Conversations with SHP. This has been a production of Strategic Healthcare Partners.
Your hosts are Jason Crosby and me, Aaron C. Higgins.
This episode was produced and edited by Nyla Weave.
Our social media content producer is Jeremy Miller.
The transcriber is Heather McKnight, and our executive producers are Mike Scribner and John Crew.
For more information about SHP, the services we offer, including the back library of episodes, episode transcripts, links to resources that we discussed, and much more, please visit our website at shpllc.com/podcasts.
Thank you for listening.
You already know that understanding your data is key to improving patient outcomes and financial performance. But how? At Strategic Healthcare Partners, our analytics services help turn your EMR and other data sources into actionable insights. From identifying areas for improvement to guiding you through implementing changes, SHP supports you every step of the way. Our performance analytics service dives even deeper, providing custom reports that help you stay ahead in the transition to value-based care. Unlock your data's full potential with SHP. Learn more at shpllc.com.